This is Manas Fatima, behavioral psychologist, and she is Ashwini. She is a speech therapist, and we are here to talk about cognition. What is cognition? And yeah, cognition is the thing how people perceive in a different way, how people think, how they behave, and it is all about adaptation, how people adapt things differently, right? If we talk about the thing like um memory, so cognition comes like um comes started with memory. So if we have a good memory, like if we have memory and we are going to present our memory, so there are some techniques how we can improve our memory. So for good memory, we have to have good sleeping habits and we have to keep ourselves healthy. Healthy means healthy habits we have to keep for our um, in our daily lives. Like we have to have good sleeping habits and healthy diets, and we have to keep forward, keep thinking in a way like we don't have to do multitasking if we really want to increase our cognition. Uh, Using multitasking method it can sometimes can be harmful in both or multiple things. If we are doing if we are using multitasking, so we are unable to pay attention towards one thing and multiple things. So if we really want to enhance our cognition, we want to work on one thing, and then we focus on another things. Okay. So how co- cognition helps in our daily life. So cognition helps in our daily life, like how people think and how people behave in socialization. So socialization is totally about engaging, talking to others, right? Having gatherings. Sometimes some people or some kids don't feel like gathering because because they don't feel comfort in gatherings. Like they refuse to having gatherings. So on this um, we just have to go in deep. Like is the particular person who are avoiding gatherings the like having social anxiety or having another symptoms of any disorders or any disease. So the thing is, we were talking about cognition and how cognition, uh, how how what are the problems in cognition. So the person who has cognitive problems, so we have to go in depth. Like are they socializing, are they able to think differently, or are they uh, talking to others, are they gatherings. So there is one s- disease called MR, mental retardation. So mentally retarded people or kids doesn't have feeling comfort with gatherings with people, doesn't talk to with anyone. They keep themselves alone and they have difficulty in speaking. They have difficulty and in memorizing things, and sometimes kids having difficulties in uh, talking. They roam around. They don't listen to anyone. They just keep doing the things what they love, like crying, don't know anything, don't understand the things. Even they don't talk to others. They don't know like anything about what is going on in a world. They really don't know about what is going on in a world exactly. So we do things like we give therapy for MR, MR and to have to increase cognition. So there is CBT. CBT is cognitive behavior therapy. Cognitive behavior therapy is a psychotherapeutic method. There is some different techniques we use for CBT. So CBT is also used in anxiety, depression, anger management. We use CBT for that all the things. And there is the thing how people influence their behavior. So influence their behavior on the things. So the thing is that if we really want to enhance or influence our behavior, what the people see and what they uh, are adapting from us. So we are psychologists, uh, work on that type of people who have mental retardation and problem in cognition. We work on autism, spectrum disorders, and we work on ADHD. So that type of kids we are dealing in. And in cognition, there is one thing. Uh, the people who are having problems in cognition, see though they feel like phase in their life and world and in their and world's thing like socializing with others. The problem is that totally cognitive cognition uh, impacts our socialization. The people having cognition don't get socialized and they don't uh, understand the things what is happening in the world, right? And another thing is that they stop learning. They totally stop learning. The MR is their mental abilities is below average for MR. So perception. What are the we are going to give you an example how cognition um, how cognition affect our attention, learning process, perception, and our thought process. So we'll talk about first memory. So in cognition, memory have a crucial role, right? If we get into something, if we, for example, if we go to any place, we don't know about that. Okay, so what we'll do, we go there, we perceive the things, what what are the atmosphere, what are the people, and what are the things we have seen. So we came to home, and after 10 to 3 or months, we are able to recall all the things or not. So if we are able or not, that called memory. Can we memorize those things or not? So if we memorizing 1 day or 2 day, it called short term memory. And if we can memorize it in a longer duration of time, so it called long term memory. So longer for short term memory and long term memory, we have to recall that things, what happened that day when we went there, what was the people, what the particular person told about the things, and what we have seen there, like these the things. And the areas, second areas in cognition is attention. So attention is the most important. If we don't pay attention towards anything, like how we can perceive, how we can recall the particular thing. So that is a thing. Attention is a part of any cognitive behavior or any cognition. If we want to increase our cognition, we just have to uh, keep attention for the particular things. So second is language. So if language is the most important part of cognition. If we don't know the language, how we can understand the people, how we can understand their behavior if we really don't know about the language, right? So we should know about the language. Okay, and then comes learning. Keep learning. So in cognition, learning helps in enhancing cognition. So learning, keep doing. If we stop learning, we are not able to, and we are not able to enhance our cognition, because if we really want to enhance our cognition, learning is most important part. Do you know, if we stop learning, how we can understand things, how we can communicate with other people? Yeah. So keep going, keep learning, keep yourself uh, keep yourself like we have to do that, we have to do that, we have to do that. We have to keep learning this, or we have to learn new language. Learning new language is the most important part in enhancing cognition. So language, if we learn language, we enhance our cognition, we enhance our brain part, our brain activity enhanced if we learn new language. If we are not able to learn new language, or else if you are not interested in learning language, you can try to do something what you would have like what you feel like it is most important, or what you feel like interesting, right? So you can also try dance. Okay, you can also try to do painting, art, some sketching. You can start with this. Okay, and then comes perception. So the particular person perceive the thing. First it perceive, and then it comes retrieve. If we do not perceive, how we can retrieve, how can we memorize? So there are some areas of cognition. How there are areas are important in cognition. So if you really want to enhance your cognition, we have to work on that. So we'll talk about MR. MR kids or MR people having issues with the things. We have yesterday I had a kid who had MR, so he really don't understand what we are talking, what we are doing. He are unable to say anything, just muttering, and he just don't socialize itself. He had his own world in that he was doing things. So MR kids usually they face some um, problems in their brain issues like the brain his or her brain part got somewhere struck. That's why they are unable to do all that things what normally people do. So that's the problem who MR people facing, and there are that's all about the cognitive psychology and cognition, and we'll come with CBT how we enhance how we use CBT for MR and enhancing cognition, right? So CBT works on emotions, behavior, cognition, thoughts, memories. If a particular person feeling like they don't have positive thoughts, we work on that. We use some techniques, some method what comes in CBT. So this is called negative thoughts and emotional difficulties. The particular person feeling difficulties in emotions and they don't have clearing thoughts. If the person have worsen their emotional difficulties, we work on that while using CBT. So that CBT has their own techniques we use in different manner with different people. We look into, we'll do according to that. We'll use techniques like if a particular a person is talking to you, so we'll use different techniques for that people. If the particular person don't understand the things what we are saying, so we do according to them. So first our criteria would be rapport building with a particular person. So we build rapport with kid or adult for using CBT, and we understand them in a depth. How the person or is the particular person are able to talk with us, are able to communicate in easy way, or they want more time, right? So we do use CBT like this. So as I told you earlier, in CBT, different people needs different techniques. Different people's having different abilities. So CBT is the thing that gives us some areas where we use techniques. We use some particular, like we use some prompts, for kids, prompts, and some numberings. For children's, we use some uh, some particular things like what they love, what they really love. For kids, they want some toys and all. We deal according to them. For adults, adults don't want uh, that type of things because they have different thought patterns. So we use different techniques and different things we use for adults, right? So it's all about psychology. Psychology is a thing where we understand like how people doing things, how they behave, and in psychology nowadays we are feeling like person having depression, anxiety, anger. So CBT also works in these type of disorders. It really works in anxiety and depression for adults. It has many positive reviews and researches. So that's why CBT is really important for us and to know. People should know about the CBT, what is CBT, what are the techniques used in CBT. People you want you need to know about that because nowadays CBT works in a very different manner. Like we can use CBT in or all of the in all of the disorders we use CBT. So it has really good effect on adults and children itself. So nowadays we are having more and people feeling and having symptoms of depression, anxiety, and children's we also can see many children's I have seen depressed. Like they want to pamper by their parents, but their parents don't pamper them. Some kids having lots of pampers while they don't want, but parents gives. So some other reasons and some life skills, life things happens with people. So they started depressed and anxiety, anger. So the people don't nowadays what we can see people don't want to say these type of disorders to others or anyone. They just got stuck in yourself, that's all, and they don't wanna get into out from that phase. So they just go to they just want to go to they just prefer to go to psychologists or psychiatrists. So this is a research we have seen and we worked on in peoples nowadays. So they keep harming themselves, don't wanna talk with others in depression and in anxiety. They don't really wanna talk to others. Get into alone in a room. Don't wanna eat. Don't wanna gathering. Don't wanna socialize. Don't even wanna talk to their family members. So we are working on that. We are having lots of cases like this. And for autism, if we talk about kids, so in kids we are having something autism. Autism we can see is a huge number of kids we are seeing who having autism. So we are working on autism ADHD also there in Pinnacle Blooms Network. Autism spectrum disorder is like the particular kid don't want to. They have their own world. They are having their own world. They don't want to talk to others. They don't want to listen to others. They don't want to engage in things. They just don't listen, and they don't want to do anything. They don't want to go to school. They don't want to do their homework. So for autism children, we start with uh, building rapport with them. We give the things what they love, and we start with CBT. In CBT, we are use different techniques as I told you earlier for different kids. Yeah, and the another thing, we also having ADHD. There are two or three symptoms different in ADHD and autism. So yesterday I have seen a kid who were having autism. So we were working on them. That was a kid um, who was just not able to recall the things. Things like I just have made them sit, but he don't want. He don't want to sit. So I make them sit. It started with talking, rapport building, and I have given some things what he liked. So they engage in gathering and they was in rapport building, and we started with the things like how they were not into eye contact. So I use a technique like there were a ring. So I started with this, and I started with counting in front of my head and uh, tell him to count till 5. So for the first time they don't, second time they don't. At the end, third time they started, third, fourth, fifth they did very well. So we started these things, and then the another thing what I have given to blocks. So blocks was for coloring identification. Coloring identification, like I have to told, I have told them, yeah, what is color, what is right, what is that color, what is this color, what is this color, and they for starting they don't do the things, and they don't follow command, and they for the first if we were use the start first and second techniques, then they start like no I can't, or they don't pay attention towards us. And then the second was I have given the blocks. So color identification was there. So I made him memorize what color it is. Yeah, that is red, that is blue, that is this. So first we have to tell them like this is how we gonna start, how we end, or this is the particular color, how we can give that. So first they feel uncomfortable or they feel just like I don't wanna do that, I don't wanna do. So we can give, and we can um, give them with high some things for rubber building, that is high 5, high 10, and we can hug and kiss also. Yeah, so if the kids build depot, then we start with, yeah, then they do the things, they definitely do. They will follow commands, yeah, as the yesterday's kid did, and they done with the following things. Yeah, we'll start and we'll make them play at the end, because kids love play. So we have to understand that kids really want to do, kids really want to understand, and for all of us, we also understand to kids, they want to play. We have to give them the particular things what they love, what we have, and what they really want to play with the particular things. We have to give them that things. And there are some difficulties can be happen in CBT. What the for starting, kids can't listen to you, was unable to listen, and because they don't know you, they feel like who you are, how you can give command how to them. So it will start from them, then days, months, and then and they start showing features, and they come come into normal life. They start behaving like a normal kid. Yeah. So that's all about autism we are working on. And next we'll talk about the uses of psychology in our daily life. So psychology is how person doing things, how if the particular person doing things in a different manner, how they are doing, why they are doing, is there any problem, is there anything behind this, because no one can behave in a different manner without having problems. So we seek into that. So we seek into that and we work on that. Yeah, thank you so much. This is Manas.